Restrictive covenants are contractual provisions that can either prevent someone from soliciting patients after they terminate their employment with a medical practice or hospital, or could restrict where they can compete against that medical practice or hospital. Doctors, hospitals, and medical practices need to know that certain kinds of prohibitions are more enforceable than others. For example, a non-solicitation provision is more enforceable than a non-compete provision because non-compete provisions are broader and more restrictive. They also need to understand that there are circumstances that affect the enforceability. And one of those circumstances, for example, would be someone who sells a medical practice and signs a non-compete. That's very enforceable. On the other hand, a pure employee who simply terminates employment, that may not be as enforceable. When you draft and interpret a non-competition agreement, it's important to look at a couple things. First, you have to make sure that there is a quid pro quo. In effect, we call it consideration for the restrictive covenant. You have to make sure that there's a legitimate interest that actually the employer is trying to enforce. And finally, you have to make sure that the scope of the restriction isn't overly broad, that it doesn't go for too long, doesn't cover too wide of a geographic territory. One of the new things in the law relating to non-compete agreements is the fact that now mere employment is not sufficient consideration to enforce a non-competition provision. As a result, we're advising hospitals and medical practices of the steps that they must take to actually make them enforceable, and advising physicians about how they can deal with their own non-compete provisions.